Good day, viewers. Welcome once again to the YouTube channel of Lower Crest Hospital. Today on our series, we're going to be talking about how to promote good mental health and also prevent mental disorders in unborn babies. Here with me is Dr. UI Uchendu, our consultant. Sir, you're welcome.
Pleasure being once again our viewers.
Well, so we have some questions for you, questions we've gathered over time. I hope you'll be able to give us good answers to them. Okay, the first question goes like this. At what age in life is a person at risk of mental illness?
Well, when we talk about mental illness and at what age, there is possibility that from time of conception, people might get to be vulnerable or predisposed to mental illness. But from the time of birth to the time somebody passes to the world beyond, there is actually risk factors that can either make someone vulnerable to having mental illnesses or disorders.
Okay, so let's talk about the period where the baby is in the mother's womb. Okay, we all know that there are 3 trimesters in pregnancy. So, sir, which of these trimesters is the baby most at risk of developing mental disorders?
There are 3 trimesters, within the pregnancy. We talk about first, second, and third trimesters. But when we talk about mental illnesses, we are trying looking at, in relation to the newborn babies, we are looking at vulnerability. We are looking at predisposing factors. What will happen or occur while they are still in their mother's womb that can make them to be vulnerable to having mental illnesses or illness later in life. But answering your question directly, first trimester is very, very important. Why is it important? That is the time there is what we call migration of neurons to specific areas of the brain to specialize, because brain is a specialized complex organ. During that period of first trimester, that is the first 3 months or 12 weeks of pregnancy, there are things that should be avoided to ensure that babies do not get predisposed or vulnerable, to mental illnesses probably later in adult or adolescent life.
Okay, thank you, sir. My next question is, what are the things that can be done to promote or to prevent mental illness in unborn babies?
Yeah, things that can be done to promote good mental health in unborn babies are very, very simple. These are things you don't need to go and buy them from the market. I'm not sure they are too expensive. One, immediately a woman takes in, the first thing she have to understand that her body, her womb has become an environment for someone that is going to come into the world in the next 8 to 9 months. Now, what happens within that environment is very, very important. And what we advise to ensure that the baby, is not probably at risk of developing mental illness later in his or her life. One, we encourage the woman to be able to take good diet, very, very, very important. Good balanced diets, vegetables, fruits, very, very important. Exercising, very, very, very important. The next thing, what are they not supposed to take? One, you are not supposed to use cigarettes, any form of tobacco, because tobacco contains toxins that can affect the neuronal migration or development of neurons in the brain. Tobacco is there, alcohol should be avoided as much as possible. The third factor I will mention is people that use weed or call recreational substances. Caffeine is also should be avoided. Then, in certain climes where people use a lot of traditional medications, like in the palace of in Nigeria they call it agbo, it should not be. It is not encouraged. Some of these traditional medications can have certain toxins that could affect the brain negatively. The fifth one I think I will talk about is even the orthodox medication. In orthodox medication, when you are pregnant, you are not supposed to enter any pharmacy or any chemist and be on self-medication. At that point in time, any medication you are using must be prescribed by a qualified medical doctor or probably a gynecologist or a doctor who knows the effects or the impact on the effect of these medications in unborn babies. Why are we saying this? Any of these things we mentioned could have negative, effect on the brain cells, and this could predispose these unborn children to mental health challenges or low intelligence after birth, probably when they are about in the adolescent age or into adult age.
Sir, please, what is the role of infection as a causative factor in this regard?
This is a very, very important question you have asked. Infection is one of the causative factors that could also affect the mental health of any person, not talk of unborn babies. And when we talk about babies that are still in their mother's womb, how do they get this infection? It's through their mom. And some of the infections we are talking about, just severe malaria, probably typhoid infection, other bacterial infection, pelvic inflammatory, diseases, genital, urinary tract infections. Any of these could be transferred to the baby through the placenta. And when it gets into the unborn baby, a lot of things could happen and could affect the integrity of the cells of the brain. Some of these things might not be noticeable at birth. Some might be. And another type of infection that yet have been noted to have deleterious or negative effects on brain of the children while they are still on their mother's womb is actually viral infections. When we talk about touches, when a woman has any of this viral infection, it also affects the development of the brain cells. And what can we do about this? We will advise, anytime a woman is pregnant, please take care of your health. Ensure that any sign of fever, don't just assume and go and buy paracetamol and take. Go and see your doctor. Tests should be run in a qualified centers, and the treatment should be done appropriately and accordingly. Any of these, if not looked into and managed as appropriately as possible, could, lead to predisposition or vulnerability of that unborn child to mental illness later in life.
Wow. Well, there you have it, our viewers. Thank you so much, sir. I think we've learned a lot from this particular series. Well, we'll have to say we hope to see you next time when we will discuss further on mental health. Thank you so much for joining in.